Hey, this is Stephanie with Theta Living Wellness and Cancer Support Center. I am going to tell you about my friend Tim today. He was diagnosed with cancer 8 years ago, and the suggestion that he got from his doctors was to let's just wait and see. And that's where they left him. Let's just wait and see what happens. We're not going to do anything right now. We're not going to talk to you why this is here, how it got here, what you could do about it, where it came from. Or give you any idea other than let's just wait and see. 8 years ago, Tim didn't really know that there were any other alternatives to that. That's all he knew. He was doing what the doctors told him. That was through the conventional medical system. So we crossed paths 18 months ago, and in myself working with his wife Amy, we started discussing his diagnosis and what alternatives to cancer treatment are, why cancer happens, and he started listening to different presentations and events he would attend with us, and he was learning bit by bit along this way. Up until that point, he had no understanding or exposure to what the natural side of cancer therapy or the alternative to chemo, surgery, radiation could potentially be. No idea, like most people. They don't know what their options are. Neither did he. So that was 8 years ago that he had that diagnosis. 18 months ago, I started planting those seeds of what the opportunity for making a different choice in his treatment could potentially be. So during that time, he had come in contact with some people who also received a cancer diagnosis, and they took the conventional route, and things didn't fare out very well for these people. And he also had the opportunity to watch some people that I had been working with go through the natural side. They took the path of what their options are. They explored opportunity to heal their body and reverse the cancer. So 2 months ago, when he had one of those routine wait and see visits, the doctors called him back into the office, and he got the news that, hey, Tim, your numbers have increased and we're going to have to look at doing something now. So in other words, sound the alarms. We didn't do anything to see how this happened, why this happened, where this came from, what's going on. We did nothing. For 8 years, we let this simmer and smolder, and we let the smoke build up and build into the point where your body got suffocated out by these leukemic cells, and now the fires burst. So we have to react. So 8 years of passive wait and see, non-action on his cancer diagnosis, and here we go. It's time to take action. We've been sitting around doing nothing. Sound the alarms, bring in the big dogs, all the fire trucks, all hands on deck. Let's take our fire extinguisher and just blast you with everything we have. And by the time we run out, hope that you're still standing. And then we'll take a look and see what's left after we're done with you. So Tim, at this point, took a step back and said, okay, hang on. That does not make any sense to me. I've witnessed both sides now. I have options. So I'm going to take a deep breath. And he did. He took a deep breath and held it for a minute. That's a big decision. There's a fear factor there. 8 years he had been living, no matter what he did, walked 2 of his daughters down the aisle, supported his wife in her entrepreneurship, worked out at the gym, maintained a full-time job, a normal life. But in that normal life, every single day of that normal life, he had that I have cancer thought in the back of his mind, and it could burst at any time, and it could get worse at any point in time, and I'm just waiting to see. I'm just waiting for that other shoe to drop. He lived like that for 8 years. So when the doctor said, it's time to go into action, we sat back all this time, now it's time to dive in for action, he said it does not sound good. Blasting me with a bunch of chemicals and hoping that I feel good afterwards, or waiting to see what happens to me, what the situation looks like after you've given me conventional treatment, doesn't feel good. So he held that breath And then he let that all out and decided, you know what? If we want to change cancer and we want that other side to look different, we have to do something to change cancer. So he knew what his options were. He was informed. He let that breath out and said, I'm going to take responsibility, take massive action, and I'm going to reverse this. I'm going to do gentle therapies. I'm going to do non-toxic treatments, and I'm going to heal my body. So he decided to call Hope for Cancer Treatment Centers, which is located, there's 2 locations currently in Mexico. And we set him up with a consultation. They gave him every bit of hope, every opportunity to feel like he was a person, like he mattered, like he counted. That was the first time in dealing with just admissions, before he's even gotten to the medical side. Just in admissions, they asked him, how are you? How are you feeling? In 8 years, that was the first time he had ever been asked that. That's sad. That's not fair. That's not right. So I just want everyone to know, because not everybody knows, 8 years ago, if Tim had to make a decision, if his numbers were any worse or any far advanced than they were 8 years ago, he wouldn't have known. He would have taken that same path and the same conventional road that a lot of people do, because they don't know that they have options. So thank you, Tim, and thank you for people who support him and are willing to look outside the box and understand that if we want to change these statistics, if we want to not hit 1 in 2.4 people being diagnosed with cancer in the next year and a half, if we want change, we have to do something that makes change, which means that starts with us. We have to take responsibility and we have to take action. So thank you to Tim for making that decision. That's a bold, brave decision to step away from what we've known and go with what makes you feel good and what settles well with you. And Tim chose hope. Tim chose to heal cancer, and it can be done, and it is done. So please follow along with him and his journey. His wife, Amy, is doing a beautiful job documenting this step-by-step process that he's going through. And I hope if you are ever diagnosed with cancer that you take that same step back that Tim did. Take a deep breath. Know that you have options. Explore those options. Reach out for help. Reach out for somebody to give you more information and that opportunity to heal cancer. If we want to change cancer, we have to do something that changes cancer.